Hi, good day, everyone, from wherever you're listening to this presentation, and I trust we're all doing well. So, I'll quickly get into it. Um, this abstract focusing on assessing primary healthcare systems through the lens of COVID 19, and this is a case study from Nigeria. These are the outlines. I'll quickly skip this. Alright, for the introduction. Despite recent success in managing COVID 19, Nigeria struggles with routine immunization coverage, recognizing the pivotal role of primary health care. The study calls for a restructuring of primary health care service delivery to enhance immunization rates. Using a performance assessment tool, the study identifies challenges, proposes strategic steps for improvement, emphasizing the importance of understanding current structures and potentially creating new ones. Addressing these challenges is crucial for Nigeria to achieve higher routine immunization coverage and improve overall public health outcomes. For the methodology, a cross-sectional observation study was conducted across 18 states primary health care development agencies or boards in six geopolitical regions of Nigeria. So just to put it in context, we're looking at a 50% assessment of a 50% sample assessment of the states that we have in Nigeria, and the study was done between May and June 2023. Using a standardized organizational performance assessment tool, six key areas were evaluated: service delivery, infrastructure adequacy, planning and coordination, partners and community engagement, and information or data management. The assessment tool was administered to stakeholders and findings were validated with respondents. These comprehensive assessments aim to gauge and validate the organizational performance of the state primary healthcare development agencies or boards in Nigeria across various critical domains. And these are the domains, like we said earlier, within the thematic areas or capacity areas that was assessed at the time. And what was our key approach? Although this was a process of an assessment, what we did was just to facilitate the process while the states do the assessment themselves. So it was a self-assessment, but facilitated by the team. And we ensure that for every performance gotten, it was evidence-based for them to achieve a score. Gaps objectively and collaboratively identified. Performance optimization or improvement plans were then jointly developed, and technical assistance or support were tailored to the specific or gaps identified. Periodic reviews of progress on this implementation was of the implementation of the improvement plans was also conducted. These were the expectations. We hope that we would be handing over an accountability framework developed and operationalized for health interventions, improve coordination structures, and improve the uptake of vaccines across the supported states. And what were the results that we realized? So, for capacity area 1, 15 states face critical functionality challenges, and these were occasioned by funding challenges, technical capacities, conflicting activity schedules, particularly with the technical working groups or the state emergency routine immunization coordination centers. These two coordination platforms are the strategic coordination platforms used for managing the expanded program on immunization. 18 states had no tools or softwares for managing or tracking activities and work plans. Poor implementation of work plans due to dwindling funding, inability to access or utilize domestic resources. 5 states lack SERIC. Although this is not an issue, because it's either you have a SERIC or you have a TWG. However, in the assessment, 3 of the states indicated interest to have one. 2 states had also noted that they will continue to leverage on the technical working group structure. LERIC in 13 states. Now, LERIC is the local government coordination structure for SERIC. So, in 13 of the states assessed, lacked funding, at the risk of collapse, and had irregular meetings due to had hindered their effectiveness. 7 states lack health plans, and so it will be good to put this in context. Now, the health plans in this regard has to do with the annual operational plan, and what we realize is that these has affected healthcare priorities, including immunization for the state. We've been able to come up with some plans. We support plan to support the state at the time to activate or resuscitate the coordination platforms needed for vaccine preventable disease interventions. We commence funding for some of these coordination platforms, as well as exploring additional funding for states or and other partners for sustainability, supporting the states to leverage on the use of existing structures like the emergency operational centers and other existing platforms to improve coordination across the state. We've been able to achieve a lot, and we had to put this in there um, so that we see that we've also made a bit of progress. 14 of these states requiring funding has now been funded. We've also had formation of 2 partners coordination platforms. We've resuscitated 15 coordination platforms across 6 states. We've also been able to deploy Asana project management software in FCT, one of the states where we are working. We've also been able to support some strategic meeting, pre-implementation, evening review, and post-evaluation meetings across 12 states. And um, this was the what a web diagram of what the assessment looks like, and we are currently working with the states to review this, and I'm sure we'll have something a lot better. For service delivery, we discovered that 13 of our states do not have referral systems and have hindered the ability of the TWGs to oversight referred cases, including AAFIs. A total of 18 states coordination platform does not have a capacity development plan in place to coordinate capacity building efforts for staff providing routine immunization services. Despite effort of the coordination structures, RI service delivery has been hindered as 13 states do not have up to 70% of the required workforce, while 5 states occasionally drops below 50%. Now, it goes to show that some of the things that we did in this assessment was to mirror the entire healthcare system. And in doing this, what we were looking at is, do we have a right health foundation that is competent, resilient enough to be able to, say, fight infectious disease, you know, challenge um, anything that wants to be pose a threat to the healthcare system. And as we go through these domains, it will be good for us to, as I walk you through this, it will expose part of the weaknesses that we have in the system. And this is across the a lot of African countries today, and I'm sure this may not be new for some of us. And in trying to mitigate some of these things, we looked at developing a capacity development assessment template which the state can use. On workforce, we realized that one of the partners had engaged additional workforce which was going to be moved back to the state. And what we did was to advocate for the state to begin to consider moving some of those workforce according to the plan. We've also looked at pushing for the adoption of a wonderful strategy which we've termed the retirement replacement strategy. And what does this strategy envisage? It's looking at for every work a senior management person who retires or leaves the system, you also have a commensurate 1 to 2 persons replacing that position. We've also advocated and we realized that there were a lot of casual workforce. We've also looked at advocated for the migration of this person from the status of of being casual staff, and we've had and or recorded some achievement in this regard, from training of the workforce in vaccine handlers training to conducting advocacy visit to Katsina, Zamfara state government, and we got the buy-in of the state to begin to allocate resources for the um, movement of some of this casual staff into the government payroll. One of the key things we noticed the states were not doing was leveraging on the power of integration. And we also tried to advocate for this. We've also had to support some of the interventions in 23 LGAs across um, across a number of states, and we've also been able to support the routinization of COVID-19 vaccine in 2 states, and this is because we wanted the states to come to the level where it becomes part of the everyday life, and as such reach out to the people as part of a sustained and strengthened system. We've also been able to initiate for the first time in the country what is called a client-led evaluation of of the routine immunization, COVID, whatever immunization that was done within the space, and we are still in the process of identifying analyzing rather the findings from this evaluation, and preliminary work is looking exciting. So on resourcing and financial management, our findings showed that our coordination platforms in 11 states do not have a plan to drive or generate domestic resources in their state. And this has greatly affected vaccine preventable diseases in these states. While some states have budget lines, about 15 out of the 18 have budget lines for funding vaccine preventable diseases, only 50% of these states have aligned these resources with vaccine preventable disease priorities. And although these exist, funding is also a challenge. 17 out of the 18 states do not have an e-based accounting system, Of course, this has affected the state in a lot of the opportunities that should have been handed directly to the state. However, there is this challenge of realizing that each of these states do not have the necessary system to be able to take on these interventions. And one of the things we've tried to do was to come up with a plan to say that, okay, we believe that the state can look at what exists currently and come up with some sort of domestic resource mobilization plan to drive resources. We've also looked at providing technical support for these coordination structures to strengthen advocacy on the release of counterpart funding. We've also had to support the annual operational plan development in in the states where we work to ensure that there is a plan to mobilize resources to fund health priorities. And we've been able to record some successes. We set up resource mobilization technical working groups across a number of states. We've also been able to outline resource mobilization plan in two of our supported states. We've also been able to mobilize resources for to resuscitate some of our meetings in Kogi State. And one of the key achievements in the resource mobilization is an activity that we just recently concluded, which is the Akwa Ibom State Primary Health Care Public and Private Sector Investment Forum. And in this forum, we were able to outline health priorities in the state, and we had a target of generating about 500 million naira, but we eventually got um, um, real funding, and we have almost double of that figure, which over a billion naira um, committed by the partners for 2024. Information and data management. We had a bit of findings, and this is one of the areas where we had lots of the challenges. There is suboptimal use of data for decision making across the 18 states, and reports depicts or shows this. 12 states do have a shared drive. Um, Many of these are almost full now, while 5 states have limited space and no subfolders for thematic areas. Majority of the TWG do not have the technical capacity for developing knowledge management products such as fact sheets, journals, infographics, etc., using already existing program data that they have in the state. So, what we have looked at, or we envisaged at the time, was the procurement and the setup of a Google Drive across the 18 states. We looked at building the capacity on the electronic management of immunization data. We've also looked at how we would continue to provide um, data during state level meetings that will inform programming and also used for engaging partners. We've also looked at we outlined that it would be important for the state to have capacity building for its staff on data mining, curation, and analysis. We've also and other areas include documentation, tracking, follow up, as well as strategic plans development. We are able to record some achievements in this regard. We've been able to procure the Google Drives. We've also been able to support the data visualization and analysis and use training for M&E and MID focal persons across 18 states. There is also retraining and provision of technical support for the EMID recorders in the state. All right. Oh, so point four seems to be a repeat of point two, so I'll skip that, and I'll quickly jump into infrastructure. The findings here, we realized that although some states had situation room, but the basic technological support for this to happen were not in place, and this was discovered in about 13 states. Um, we noticed that four states do not have a vaccine storage and handling protocol. Eight states do not have adequate infrastructure to support timely availability of vaccines. And due to funding gaps, coordination platforms do not monitor compliance with vaccine wastage management, even though eight states have confirmed poor adherence to guidelines. What we thought to support the state with at the time was improve the data visualization, communication, as well as documentation, and archiving rather. And in this regard, we looked at procurement of TVs, HDMIs, desktops, routers, and ensuring that they have subscription, um, as well as advocacy to state for improvement in vaccine logistics and waste management. So we've been able to ensure that these systems are procured. We've also been able to, and this was done across 11 states, we've also been able to ensure that we have 1 terabyte of data available to support this state for the next 1 year. With respect to engagement, the findings shows that the involvement of the lower level structures like the community structures has been affected due to poor resourcing. We've also seen that due to suboptimal funding, partners coordination platforms, excuse me, and engagement with other ministries, departments, and agencies has been affected or was affected in 14 states. For the optimization plans, we at the time plan to continue to support the partners coordination platforms to improve accountability, support states to ensure more involvement of community structures in our interventions, and we've been able to have some level of achievement. We've supported the engagement of traditional rulers in two of our supported states. We've supported the advocacy efforts, um, focusing on the task force on immunization to across a good, I think we've had recorded that in five of our states and provided feedback and also address the challenges. We've also supported the flag of COVID-19 wrap up exercise, NIPDAs, SIs, OBRs in in almost all of our states, but these are the states where we have deeper involvement. We've also noticed that there are areas beyond our scope that will be good for us to have additional resources um, to continue to provide support. And we divided these into technological and technical. For the technical, we would like to see an expansion of this baseline study um, to include all 36 states so that there is a national baseline. We also want to see that we have a sustained technical assistance to the states, and this is in line with best practices. One of it is the Global Fund Resilient and Sustainable Systems for Health, where it's been advocated that we should have the support for a period of time between 3 to 5 years, implementation science research on vaccine programming, um, as well as should also be advocated. We've also talked about the development of comprehensive knowledge management materials is also very needed, and these are areas where state can be really supported to showcase the work that they do, as will envisage additional improvement on the system. We've also seen that as we begin to routinize the COVID-19 vaccination, and this is not only on COVID, currently the country is also trying to routinize HPV. Capacity building for service providers as well as procurement of gadgets to support reporting is very crucial. We've also seen that there is need to support these states where resources has been provided to ensure that there is a mechanism for realignment of resources, and I think this will address a number of challenges around the service delivery pillars. For the technological interventions we've had, and this is one area eHealth is very strong in. We looking at digitizing or digitalization of the referral and tracking system, digitalization of the management of project activities using softwares like Asana. Like I said, we have a use case where we have supported this deployment in FCT. Capacity building management for the management of the state primary healthcare board is so important. We've had a number of people leave the system, and we have new persons come up into the system, and we believe that if you don't train them, then you can blame them. A number of these persons will need to understand their roles in building a resilient system for health that is able to combat any infectious disease, be it a pandemic, whatever it is. We would be able to have a system, a leadership in place that would drive processes. Whilst we were able to support the situation room in about 11 states, one very crucial area that is needed is renewable energy. And this we already have use cases in our emergency operation centers that we're supporting. However, for this situation room, we think that it will be very crucial that these states have such level of support. In conclusion, um, the study you know shows that there is considerable performance variation amongst the states, um, with lower scores in information and data management, as well information data management and service delivery. It identifies internal strengths that should be maintained and highlight areas that need quality improvement. The findings serve as a diagnostic tool revealing weaknesses in information management and signaling potential vulnerabilities in data systems crucial for decision making. The lower service delivery performance indicates a need for targeted interventions. The conclusion emphasizes the importance of ongoing assessment and adaptive strategies to address identified gaps, offering a strategic roadmap for states to enhance healthcare capacities and system resilience. Thank you, and over from us.